Hello, everyone. Good afternoon. Welcome, as they used to say. Who used to say that? That was Bruce Forsyth, wasn't it? To the meeting of the Health and Wellbeing Board today, the 19th of March 2025. Welcome to everybody. It would probably be quite useful if we could quickly just go around the table and introduce ourselves, and then we'll talk to people online as well. So can we start at that end?
Good morning, George. Morning, it's afternoon, isn't it? Crikey. George Graham, Detective Chief Inspector, Dorset Police.
Good afternoon, Brad Stevens, Area Manager for Dorset and Wiltshire Fire and Rescue.
Good afternoon, Margaret Guy, Vice Chair of Health Watch Dorset.
Hi everyone, Sarah Howard, Deputy Director of Place for NHS Dorset, ICB.
Hi everyone, Alice Deacon, Corporate Director for Commissioning and Partnerships in Children's, and also note apologies from Paul Dempsey, the Executive Director for Children's, and I'm representing him.
I'm Paula Bennett. I'm from Dorset Voluntary Community Sector Assembly. Quite a mouthful. Thank you for having me.
I'm Steve Robinson. I'm Portfolio Health and Social.
Mark Turson, Corporate Director for Commissioning and Improvement for Adult Services in Dorset.
Hello, my name's Julia Ingram. I'm Corporate Director for Adult Social Care Operational Services, and apologies from John Price, who is unable to attend today.
Good afternoon, Rachel Partridge, Acting Director of Public Health.
Hello, I'm Andrew Billany. I'm Corporate Director Housing and Community Safety for Dorset Council.
Good afternoon, I'm Jill Taylor. I'm the Cabinet Member for Housing and Health.
Hi everyone, Councillor Claire Sutton, Cabinet Member, Children's Services, Education and Skills, and apologies if I'm going to keep it 3 o'clock.
Judith Dean, I'm here in my role as Delivery Director for Integrated Neighbourhood Teams.
I'm Don Nordberg. I've just taken over as Chair of Dorset Community Action.
Nice to meet you.
Good to meet you.
We also have a number of people online. We have 14 people online, so we won't go through all of them unless they're actually presenting. But everybody who's online, welcome indeed. Just a reminder to everybody that this is a public meeting. It is being live streamed. So in the words of Davina, please do not swear. Apologies today from Jonathan Price, Paul Dempsey, Jan Britton, Stuart Little, Chief Superintendent, and Patricia Miller. I should mention that we are having our Ofsted inspection this week. Every now and then, members of Children's Services may get a phone call, in which case they go with our support and complete understanding. So moving forwards, the minutes for the meeting held on the 24th of November 2024, for those that have seen can ask everybody to read them as correct record. Yes, and therefore they are approved. George nods his head, so that's good. Any declarations of interest to be made today that haven't already been informed? Not aware of any. Public participation, I don't believe we have any. No. Oh, it's going well so far. No, I mean, we welcome, obviously, contributions from all members of the public, so if you leave that, we could. Councillor questions? I don't believe we have any councillor questions today. And there are no urgent items. So, first item, item 7. Back in July, I think it was, last year, we started a process that is now called Future Care. And Lou, do you want to talk about that?
Yeah. Thank you, Steve. So good afternoon, everybody. My name's Lou Ford. I am the Strategic Health and Adult Social Care Integration Lead within Adult Services at Dorset Council. I am a Senior Responsible Officer and SRO on one of the work streams within the Future Care programme, and also have a role in the programme in terms of the governance. So you do have a report in front of you. And I think, George, you're going to share the slides for me now, aren't you? So George is going to share some slides on the screen that I will talk through. Fabulous. Thank you, George. So yeah, so transforming health and care together. That's the strapline that we're using across our integrated care system. And what you can see on screen there are some of the high priority transformation programs that we have in place. Integrated Neighbourhood Teams, which is on the agenda for today, and Future Care, which I'm going to update on now. working closely together to align for improved outcomes for people. Thanks, George. So why future care? So if we could just skip to the next slide, George. So as Councillor Robertson has mentioned, back in last summer, we undertook a diagnostic of the end-to-end pathway around urgent and emergency care. So we recognised that Dorset as a system was challenged in terms of the pathway, especially around the flow through the hospital system. So figures for no criteria to reside were significantly higher than the England average. So the England average being around 13.5 days, but the Dorset average being around 18.6. And also length of stay was far in excess of what we would like to see. So you can see there some of the outputs of the diagnostic. We've brought these here into Health and Wellbeing Board already, but this just gives you a quick reminder of some of the challenges that we were facing. Thank you, George. So throughout the diagnostic, what the data was showing us in terms of where we could improve is around the capacity that we have in acute bed days and what could be released. How many more people could be discharged home rather than going into bedded care of some description? How many community bed capacity days could be released alongside acute hospitals? How many fewer hours of home care could be used? And how many fewer people could be placed in residential or nursing care placements in long term? Thank you, George. So we mobilised the programme at the beginning of January. I think our last update into Health and Wellbeing Board talked very much about the process that we were going through to build a programme, the right governance, how we were seconding our staff from across the system into the programme. Some of the key feedback that we've worked on since the diagnostic has been around what we need to change for people. So that's both residents and people who live within Dorset, but equally people who live and work within our Dorset system. And you'll see here some of the feedback that we had from people during the diagnostic is around how long they were having to wait, how much care they thought they might be getting, what the cost of that care might have been, and equally, some of the feedback from staff around working in a challenging system, about how stretched they are, what the vision for the system is. So these are all things that we've picked up on. We're doing a lot of work with our communications across the system. So staff within each of our organisations get a regular update on the outputs of the programme and how the programme is moving. But equally, really strong engagement that we've kicked off with our voluntary community sector. So through working with the VCSD Assembly, we've established an event for April, sort of late April, where we can introduce both this programme as Future Care, but also the Integrated Neighbourhood Teams programme, and just sort of flowing into our voluntary community sector some of the outcomes that we're hoping to achieve for the programme, some of the services that may be needed by people, and just to really raise the kind of profile of the work that we're doing as a system across Dorset. Thank you, George. So we've said all along, Future Care, it's an ambitious programme. It's an 18-month programme, so we started in January. We are due to complete the programme by the end of June 2026. So it says 27 on there, that's a typo, so I apologise for that. But I think one of the key things from this slide that we wanted to raise is the quote from Patricia Miller. So Patricia is the SRO for the Future Care programme, and it's a huge opportunity for Dorset to deliver better services through collaboration, innovation and digital transformation. So when we talk about digital transformation, we're talking about some of the data and how we can use that to drive the decisions that we make, to make better decisions and to deliver better care for people. And why the programme matters? Because we will reduce that pressure across the system, we will improve the flow of patients through our hospital systems, we'll enhance people's outcomes so that they get a better outcome, but also from a staff perspective, and we've talked about, I've talked to clinical staff and operational staff, we will be optimising our resources and our workforce capacity. Thank you, George. So the Future Care programme is made up of 6 work streams. So the work streams have come have been built out of the diagnostic phase and the findings. So alternatives to admission. So when we talk about alternatives to admission in the future care space, we're talking about people who present in an emergency department, so in an ED department, and then go on to a hospital bed. What we want to do is reduce the number of people who are going on to a hospital bed through finding alternatives. So that's making more use of capacity in our community. Transfers of care. So this work stream is very much around decision making, around the discharge planning, the process and the flow through our system, and using data which is more readily available and more timely to make decisions more quickly. And it's giving our staff access to data to enable them to see the full picture of somebody's health and care. Home-based and bed-based intermediate care, so really improving the capacity and the effectiveness of the flow through short-term intermediate care beds, but also through reablement and rehab at home. So they're the 4 operational work streams, and then you'll see the 2 enabling work streams, which is system visibility and active system leadership. So that's around the data that we hold, how we're making that data more visible, how we're giving people access to the right data at the right time, and how have we got that single version of truth across our system in respect of our performance. And change, capability and development. This is around ensuring that we have the right culture, the right behaviours to enact and sustain the change that we need. Thank you, George. So it's a very structured approach to the programme. So just to give some background, and these slides will be shared, but all of our work streams are now either in the inform or coming out of the inform and into the adapt stage. So in the inform stage, there have been lots of workshops, lots of conversations with operational staff, social care, health staff, really talking about the problem, really understanding the challenges and ensuring that we don't simply jump to a solution, but that we really understand the problem and the challenge and we work towards the right solution. And like I say, one of our work streams, transfers of care, is now moving into the adapt phase. So that's the solution and the designing of the next stages. Thank you, George. So I'm going to give you some key highlights. The rest of the slides in this pack then give a bit more detail on each of the work streams, so I won't necessarily go through those. I'll let you read those in your own time. But key highlights from the programme to date. So in terms of the transfer of care work stream, so we've now got a hub based within Dorset County Hospital where staff can come together, clinicians, social care staff, health staff, and have conversations more quickly, more timely around the onward care for individuals. So that's as I said, in the Dorset County Hospital. That process started earlier this month, but will roll out to University Hospitals Dorset from May. Our no criteria to reside numbers have started to fall, albeit slightly since the start of the programme. So, working together, the effective decision making is supporting that upturn in performance. Benefits tracking for the programme. So, as we know, the main aim for the programme is to deliver the improved outcomes for people, to have a more person-centred approach to our care. But equally, there are financial savings, attached to the programme. And at present, 3 months in, we are on track to deliver those benefits from, in June next year. And the first iteration of the system visibility dashboard, which is the end-to-end view of the urgent and emergency care pathway, has been developed in a prototype. It is automated. It is built within our current infrastructure, for technology infrastructure, and will refresh on a regular basis. And as I've said, inform phases are complete or nearing completion. Thank you, George. So, as I said, slides on these next four or five slides: transfers of care, home-based intermediate care, bed-based intermediate care, alternatives to admission, system change and capability, all give you a little bit more detail around the starts of the programme for each of those work streams, what they found in terms of identified opportunities from their informed phases and next steps. So George, if you could just scroll to slide 15, please. I'll just touch on this one again because it's my work stream. So system visibility and access system leadership. So as we said, enabling access to the digital capability and trusted data that we need to either co-design a process, transform our culture, or make people's jobs easier. So supporting people to get the right care at the right time in the right place. Really important step forward in terms of the development of a automated dashboard which shows end to end and contains data from our acute trusts, community trusts, intermediate care providers and the local authority. This is a challenge nationally for health and care systems to achieve that end-to-end view and to have that single version of the truth. So we are moving ahead with that, and it's all coming together really well. So the next stage for us will be around how we embed that across our system and how we roll that out. Thank you, George. I think that's the last slide.
Fantastic, thank you. So what I'm hearing is that it started, it's on time, and it's working. Would you agree?
Yeah, no, absolutely. I think, as I said, we've rolled out and worked at significant pace across the programme, going through the right governance forum, shaping those work streams, and system working, partnership working, collaboration, across local authorities, acute community trusts, intermediate care providers, has been really strong. It is an absolute strength of the programme.
Do we have any questions around the table or online? I have one or two comments.
Just to say that
Just to remind everyone who you are.
Sorry, Margaret Guy, Vice Chair of Health Watch Dorset. We've been invited to help with finding out the experiences of people being discharged from acute settings into community hospitals in Blandford and Wimborne. So very much an example really of hearing what it's like and the experiences of people who are actually part of this whole process and experiencing it.
And we have,
what are they telling you?
Sorry?
And what are they telling you?
Well, we haven't. We've just been asked to do it. We're literally only just been asked.
Right.
So we're trying to gather some case stories. So that will be the next piece of work. Yes.
So for me, this has three aspects. It's before hospital and making sure that people only go to hospital that really need it, and in hospital and hospital discharge. And I think much of the focus at the moment is on what's happening within the hospital systems. But one thing, as you know, that I'm quite keen on is community engagement, and how do we work with and engage with local charities, local community groups and individuals to make sure that the right people are going into the right places at the right time. So Lou, do you want to give us a bit more information around there, please?
So yeah, no, absolutely. And I think just to be for clarity, you have got a presentation on the Integrated Neighbourhood Teams programme on the agenda today. And if you think about those two programmes in parallel, we've got Integrated Neighbourhood Teams in terms of what's happening in the community, care closer to home, prevention, stopping people, being in that hospital, attending that hospital, ED department. In terms of future care, what you've got is when people present in a hospital setting, is there a better place for them to be rather than in a bed? So that's the work of the future care programme. I think there's a big piece of work around how we work with our communities as well, and how we disseminate the detail around where's the best place to go, where's the best place to be, and a lot of the work within the Integrated Neighbourhood Team space will roll some of that out because your care will be available to you more closely to where you live within your local community.
Sounds ideal. Look forward to hearing more information as we go forward. Thank you very much, Louise. I really appreciate that. Thank you.
Thank you.
So moving forward, the place-based partnership update, and we are joined by Rachel.
Hello, good afternoon. This will be a brief item, but it absolutely...
Just remind everyone again.
Sorry,
Yeah.
Rachel,
I know, okay.
Acting Joint Director of Public Health for Public Health Dorset. So this is just a very brief verbal update, and it really fits in the spirit of the content of the broader Health and Wellbeing Board today. And it was just to keep us all aware of progress that's being made towards place-based working, and to remind the board members that place-based partnership boards are being seen as a really important opportunity to work in the Dorset Council footprint to deliver on the strategic priorities that have been set out already as part of the Integrated Care Partnership Strategy, but also importantly around the Health and Wellbeing Board strategy. So in the next meeting in June, the expectation is we'll bring a light touch refresh of the strategy, but really importantly, bring an update paper with a prospectus on how a Dorset place-based partnership work could look like, and include the priorities from both Dorset Council but also key partners, to make sure that it's really well articulated and it's a space by which we can identify those key bits that we will work on to deliver the ambitions of the two strategies for Dorset. So very much bringing it to life. It's early stages yet. I know that there's a follow-up meeting next week, including with Dorset Healthcare, Sam Crowe as the interim chief exec, but also importantly, he's made it very clear that he's keen to maintain the SRO leadership around the communities for all element of the Dorset Council transformation and council plan. So really bringing it all together in terms of identifying ways in which we and our teams can specifically work together to deliver on those shared priorities and agenda. So really bringing it to life, the kind of doing place as part of the Health and Wellbeing Board. So recognising there's a lot of work going on in the background, both from a Dorset Council perspective to align how to help deliver the council plan and our work with communities, but also linking it to the Integrated Care Partnership Strategy as well, which we as the Health and Wellbeing Board have really signed up to. So it's a whetting your appetite to allow further engagement outside of this meeting in advance of the June, because it will be there to reflect all of our work, and just asking board members to help support the drafting and development of a prospectus that will be an output to articulate what we're committing to do. So I know that it's a busy agenda, which is why I've kept it really high level, but we thought it was important to signal that there's very concerted effort to move this on and bring a Dorset place-based partnership to life.
I was going to cough, excuse me. Apologies. Any thoughts or comments on Rachel's?
Who do we contact?
I'm happy to be first point of contact, or Sam Crowe is the SRO, but I think maybe for the first instance, it could be me, and I will make sure it is the appropriate colleagues. Okay. But really happy.
Can I have your surname again?
Partridge.
Partridge.
As in pear tree.
Well, I was just going to add, because I think this is interesting. Who are you again? Sorry. Mark Tyson, Corporate Director for Commissioning and Improvement for Adults for Dorset Council. I think because we're also working obviously on fleshing out all the kind of communities for all, how that relates into the kind of the refresh of the adult social care strategies that we set about 18 months ago. And I think all of that's going to come through at a very similar point. So I think there's an important moment in trying to kind of bring a coherence to all of that, really, and have these footage.
I'm pleased and reassured to know that John Price is very much part of the working group. So yeah.
Hi, everyone. I'm Sarah Howard, Deputy Director of Play for NHS Dorset. I just wanted to add our endorsement really from an NHS Dorset point of view. And if I can be the conduit to help form what that place-based partnership might look like, I'd be really keen to be involved. But absolutely, I think it's a great thing to be doing. And I think we're doing so much joint work now and joint kind of initiatives. I think it's the ideal place to bring those together and make sure we're all aligned.
Absolutely.
Very encouraging. Good. Thank you very much indeed. Better Care Fund. Please do.
Yep. So Mark Tyson, Corporate Director again, Commissioning Improvement. So the Better Care Fund paper in front of you is the quarterly update, and Sarah Sewell is online to give more of the detail with support from other colleagues as well. And then there's a bit of a note in here as well about how we are working to set the 25-26 Better Care Fund plan. And I think, again, a really good set of connections between the items on this agenda. And I think if we heard from Future Care, we've heard from the place-based partnership, we've got the integrated neighbourhood teams later, we've also got our adult social care transformation, our future council, the new council plan. And if that's not obviously enough different moving parts to kind of assimilate, of course, we've now got to take on board the potential, which we don't know yet, around the changes that were announced for the NHS governance and NHS England and so on. So there's quite a lot of moving parts into which has been dropped this quite, I think, bit of machinery, which is the Better Care Fund, that kind of just sort of bolts a lot of our ambition and finances together. And I think it's probably just the high level at the moment is a lot of conversations which are focusing on how we hold steady some of the investments that we've got going at the moment, so that things like, particularly Future Care, because the Better Care Fund is particularly about the out-of-hospital journey and some of the services around that. So it's really important that we kind of hold those steady whilst Future Care delivers our kind of longer term ambition, and we can then start to properly reshape around it. So Sarah will give the updates and some of the more detail, but I thought that was quite a useful piece of context to just set at the outset, because it's slightly not an easy landscape at the moment in which to try and plan something like the Better Care Fund. Sarah.
Hey, thank you. Thanks, Mark. Good afternoon, everybody. My name's Sarah Sewell. I'm Head of Service for Commissioning for Older People and Home First, and I'm joined today by my colleague Jenny.
Hi, I'm Jenny Crawshaw. I'm Senior Lead at the ICB. Thank you.
So I've got a familiar sort of run through for the board today, just to take you through the report and also Appendix A as part of the reports pack. I'm seeking recommendations today, please, that you retrospectively endorse the Q3 template, and to please note the update on the 25-26 policy guidance and also the live work that we have underway to develop our new plan for the new financial year. Just bear with me, just having a bit of a delay on my screen. Okay. So as I mentioned, the board will probably be familiar with the BCF template format, but by way just of a bit of a recap. So Appendix A in your pack is our Q3 return, which we submitted to NHS England on the 14th of February, and we were reporting guidance against our initial plan that we sent in on for the financial year of 24-25. The template mirrors previous submissions, including confirmation that we continue to meet our national conditions and our progress reports against the Better Care Fund metrics, demand and capacity forecasts, which includes some supporting narrative, and our progress with our spend and, as the template refers to it, outputs delivered in that period. And just by way of a reminder again, the BCF contains funding for Dorset of around 153 million for this current financial year that we're just approaching the end of, and we remain on track to spend those funds in line with our initial plan. So just in terms of a bit of detail in terms of our Q3 performance that's included within the pack. So pleased to confirm that we're on track to meet 3 of our 4 targets. So we're on track to meet avoidable admissions, discharge to normal place of residence, and the rate of permanent admissions to residential care. Falls is an area that has challenged us during Q3 with significant demand for emergency admissions due to falls related injuries. We've outlined in the report the varied offer that we have to both prevent and respond to falls, and we're hoping that the forecast that we have for those will start to show an impact in our Q4 performance looking ahead. As I say, there are some examples within the report that outline what we have in place, but they include balance clubs and chair-based strength exercises and a falls response service, which includes medication reviews to help prevent further falls. Looking ahead to 25-26, the Future Care Transformation Programme, as Mark's referred to, will enable us to make further improvements against this set of metrics. And indeed, alignment to the work streams in Future Care are mentioned in 2.8 of the report, just to kind of refer directly those metrics to those Future Care work streams. I thought it might be helpful just to sort of give you some sort of more detailed examples of the impact that our Better Care Fund investment has for Dorset's residents. So I've just included here an example around promoting independence. So up to the end of Q3, we'd provided 8,765 pieces of equipment from our integrated community equipment store. So that includes a range of equipment from simple aids for daily living, such as walking frames, bathing equipment, to more complex kits such as profiling beds and ceiling track hoists. And that specialist equipment is also available for children too through that integrated community equipment store. So we are supporting that kind of all age areas of the Dorset population. I've mentioned in terms of care home placements, but we have managed to consistently reduce the number of permanent care home admissions over the past 2 quarters. So we're enabling more people to be supported to remain in a home of their own. And finally, just a bit of data in terms of our trusted assessor service. So working from Dorset County Hospital in Dorchester in the main, but also supporting community hospital discharges. Up to the end of Q3, 488 people have been supported to leave home to their care provider. Most of those people are elderly people. However, there is a growing number of learning disability individuals who are supported via the trusted assessors, particularly in the admission avoidance space from the emergency department. So sort of a growing support area there. Before I move on, just to give you a couple of highlights and headlines for the 25-26 guidance, I just wanted just to raise just a quick point of detail around the expenditure tab in Appendix A. I know Councillor Robinson, you've raised a couple of times before in terms of we have some high value lines within our expenditure where we don't have the outputs aligned to those, and just wanted to clarify out of transparency that that is because a lot of those lines are staffing lines across health and social care teams, so it's quite difficult in terms of data capture to give exact numbers of people supported, and sometimes those lines are also split funded, so again it makes the data capture quite difficult. We've got some plans for our 2025 plan which will look to streamline that and also give greater clarity to the scheme descriptors as well, and we've sought some guidance from the BCF regional lead on how we can kind of do that moving forward. So just before I kind of just finalise on the recommendations for today, I just wanted to give you a quick update on as a look ahead to the 25-26 policy framework and the planning that we have underway. The new guidance was published on the 30th of January, and we had to submit an initial draft plan for feedback in early March, with full submission due on the 31st of March. The format of the next financial year's plan is very similar to before in terms of it's a narrative document, an Excel template, and some demands and capacity reports. Unfortunately, due to the timescales, we haven't been able to arrange a health and wellbeing board to approve all of those plans in advance. So I wanted to take an opportunity to share the highlights with you now, and we will share the documents via email before we submit them finally on the 31st of March. Sorry, excuse me. So just in terms of the BCF objectives, there is a new policy framework for the new financial year, with the focus being on reforming and strengthening neighbourhood services across health and social care. So we have goals of providing more care closer to home, increasing the focus on prevention so that people are living healthier and more independent lives, and harnessing digital technology to transform care. That converts into different BCF objectives for the next period around reform to shift focus from sickness to prevention and to support people living independently, and again that shift from hospital to home. We have some key features which we're keen to just highlight that we're planning on including in our plan for next year. So there's the transformation of urgent and emergency care via the Future Care programme that Lou's just taken us through, the integrated neighbourhood teams programme, which I think you have an item coming up on in just a moment. So they're kind of key transformation areas that we'll be talking about in our plans. We'll continue the existing system-wide work to enable more people to remain in a home of their own. So that will be through our integrated community equipment service, through our tech offer, and through our disabled facilities grants. We're doing lots of work from a commissioning perspective in terms of working with our Dorset market to develop more strategic provider relationships so that we can develop the enhanced services that we need to meet more complexity in the community. And we also plan to continue to expand our BCF into all ages. So we plan to include birth to settled adulthood resources in our new plan, and also continue the all age carers investment. So just to summarise, recommendation to the board today is to please retrospectively endorse the Better Care Fund template for Q3, and to note the policy guidance and the work that we've got underway to develop our new plans.
Thank you very much.
Thank you.
That is a lot of paperwork, which is doing an awful lot of good work. For those that, for me, this has taken a few months really to digest how the Better Care Fund works and how it is broken down. There is a summary of the 19 key points of how it works on page 36 of the agenda pack, which is quite useful because it gives the overall themes with a very useful other at the end. But what it is particularly good is that it's a real physical manifestation of the partnership between the NHS and the council in meeting our joint objectives. And I think going forward, particularly the objectives of the Integrated Care Board and the Integrated Care Partnership and the ICS strategy and Dorset are coming together in terms of our delivery. And so I'm phenomenally encouraged that we have similar vision and similar objectives. And it's always really, dare I say, enjoyable to sit in a room with people who get it and have the same vision and passion for their communities. Are there any questions on the report before we move to the recommendations?
So Paula Bennett's from the Dorset Assembly. I was kind of curious reading the report that there'd been less community demand for rehabilitation and reablement support at home. Seemed sort of counterintuitive with the plans that are in place at the moment to increase that. So I just wanted, do you have any indicators of why it might have been on a downward trend? Or?
So yeah.
Should I come back on that? Yeah, so this is just for one quarter, and it is an unusual kind of trend, and we think that it's likely to be linked to there was higher acuity during that period, so we saw more people being admitted to hospital, and when they were therefore ready to either they were then therefore either weren't able to continue to keep them in the community, they needed to be admitted in order to be supported. So there's some links there in terms of that acute demand in that period.
To watch.
Indeed.
It is one to track and make sure that we kind of see that go back to where we would expect it to be.
Thank you.
Any other thoughts? Then moving forward, recommendations to. Sorry,
Yeah, Rachel Partridge. Just really great that it's being brought to life. It's really great to hear the difference that's being made to residents and in communities, and having the examples of good work. For me, and compliments to Sarah, it really allows us as a board to understand what difference this mechanism, as you say, it's a tool by which we can use to work together in a partnership way to support our residents. So I just thought it was worth highlighting that. It feels it brings it to life.
And moving forward on to the next item, agenda item as well, will further be bringing together of these streams. So the recommendation is to endorse the Better Care Fund reporting template for Q3 24-25, approved under our previous delegated authority. So The officers have previously seen this. I've previously seen this and approved this, obviously, but retrospective approval is sought, which I'm assuming is not held. I think we can assume that's there. Oh, we need a formal proposer, sorry. Can we have a proposer, please? I will propose it. And the seconder? Anyone against? Then that is clear. And item 2, to note the 25-26 Better Care Fund policy guidance and work underway to develop new plans. That's just noting rather than a vote. Thank you very much. Thanks, George. Thank you. Item is integrated neighbourhood teams. It's good, isn't it?
Excellent. It's all kind of flowing, isn't it?
It is.
George, I think you've got our slides. So hopefully everyone's had an opportunity to read the paper.
Introduce yourself again.
Apologies. Sarah Howard, Deputy Director of Place.
Such a hypocrite because I never do that.
And I'll let Judith introduce herself in a moment, but we're going to do a little bit of a double act and I'm going to start off. And I really wanted to start off by just kind of putting the Integrated Neighbourhood Teams programme and approach into context, particularly as we've heard about the Future Care programme this afternoon, and really think about how this fits with neighbourhood development more widely as well. So if we can go to the first slide, please, George. So just really kind of high level, what we've got here are our Dorset ICS ICP priorities around prevention and early help, thriving communities and working better together. And I think the work of the INTs kind of covers all of that. And I think we'll go through the detail and bring that to life in a few moments' time. But just wanted to make sure that we're all aware and sighted on the fact that it is aligned to our joint strategic priorities. So if we could just go on to the next slide, please. It's quite difficult to see this, or see it on the screen, but hopefully you've seen it in the report or you can see it on your own individual screens. But this particular diagram is part of, or came out just before Christmas in the NHS Neighbourhood Health Guidelines. And it describes an approach which I think is actually really quite helpful in putting everything into context for us. And I think when we think about what we've heard from Lou, for example, about the Future Care programme, that's really about that kind of intense period of time when somebody might need support to either prevent them going into hospital or indeed support to get them out of hospital more quickly, and then that support when they come out of hospital back at home. And in many respects, that's very much what's kind of described in that dark blue circle there. It's that really intense health and social care support for that person at that particular time. When we talk about integrated neighbourhood teams, I think we're coming kind of out, particularly within that kind of turquoise circle. So we're still talking pretty much at the moment around those kind of health and care teams with the voluntary sector kind of supporting as well, but kind of more downstream. So really supporting much more with supporting people in a proactive way, those individuals that perhaps have got complex long-term health conditions. We're talking about adults and children. And we're thinking about how do we wrap care around those individuals, bringing in all of the organisations that need to be kind of wrapping around those individuals. So that certainly is a focus of the integrated neighbourhood teams. But also, as we kind of come out towards the outer circle, that talks about connecting health and care to wider public services. And it talks about social care, public health, other local government. But I'd like to, if we could describe this ourselves, I'd be adding in there our partners in education, in housing, voluntary sector, of course, and really thinking about how do we increase community resilience and encourage an approach where individuals really take control of their own health and well-being. So I think that's helpful to some extent in terms of framing the whole INT work. But I think what's really important is that we also recognise all the great work that's taking place in terms of developing thriving communities, for example, where we're looking at the BCSE approach to supporting older people thinking about the work of the local alliance groups and children and young people and how we're bringing together, you know, youth workers and voluntary sector and what have you, to think about the priorities of young people in a particular neighbourhood. So I think it's really important that we recognise that all of this is really interlinked. And I think that's where the place-based partnerships will come in, to be able to kind of hold that. So I'm going to stop there. I'm going to pass over to Judith, who's the director of the INT programme, to go through where we're at and what we're doing.
Thank you. So I'm Judith Dean. I'm the Transformation Director for Dorset Healthcare and Dorset County Hospital, and I'm the Delivery Director for the INT programme. So we've got a few slides to kind of go through with you today. There is some more information in your pack. However, if you leave here thinking I'd really like to know more, then please do come and speak to me, because I could talk for hours on this. I promise not to today. So just in terms of how integrated neighbourhood teams will help, a colleague of mine describes integrated neighbourhood teams. If you think about all the ingredients of a cake mix, of integrated neighbourhood teams being the egg in that thing, with those things that bind that together. And we've heard today lots of really good work that just needs to kind of come together. So integrated neighbourhood teams certainly doesn't do all of this on its own. But I think it's a real opportunity to make sure that we ground some of this together. So a shared ambition for the teams to improve health and wellbeing of the population. And why we think this will help is that integrated neighbourhood teams, which are about bringing those multidisciplinary, multi-agency teams together to work with the community, should be able to provide much better holistic care. So by joining those teams up together, being able to address physical, mental and social health and wellbeing needs, rather than the siloed approach that we sometimes experience now. Be able to improve outcomes by more effectively managing chronic conditions, preventing complications and improving recovery rates, improving efficiency by streamlining processes and making the delivery of care and support more efficient. I can't tell you how bonkers some of our systems are, the way that we work now, which causes real pain for our frontline teams, and that's being experienced by patients and service users. Better prevention and early detection, really thinking then about that preventative care, addressing those health and social care issues early before we've reached crisis, and reacting to those. Preventing hospital admissions by managing conditions more effectively, particularly for those more vulnerable individuals or those who are living with more than one chronic condition. Interestingly, the government says that 7% of the population account for 46% of admissions into acute hospital admission. So it's a small proportion of people who we really need to be serving much better. Community engagement by involving local communities in both the planning and delivery of care and support, and reducing care costs by improving some of those efficiencies, reducing hospital admissions and preventing those crises happening. So why will they be better for people? George, can you just, thank you. So just in summary, really, and I think you probably will have worked this out, but this should lead to more joined up focus around prevention so that people can stay well for longer, more information and support for people to take better control over their own health, streamlined support so when people do get ill or require, have an urgent need, that actually we can provide that in a much more streamlined and accessible way. Proactive and personalised support for people from a multidisciplinary team for long-term conditions or complex health and care needs, and services that are co-designed with local communities. So they meet local needs and are delivered in a way that works for that community. So rather than us designing services that work for statutory services, actually designing services that work for the people who need to use them. And by contrast, we should then see less need to travel as we're thinking about more care and support being delivered in the community, less health complications and poor outcomes for adults and children with complex needs, because we've got that support available earlier and available locally, and less need to repeat the story. That part about when you see different professionals, it feels like you're starting again. And as teams are working together and sharing information, we should really see a great improvement in this. So this is a multi-year, multi-partner programme. And the first 2 years of this programme, if you move us on, George, that'd be great, are really about proving the concept, acting as that catalyst for change and building the foundations for integrated neighbourhood teams. So sadly, the world we live in means that there isn't investment for additional new staff at the moment. So the very first thing we need to do is to create the capacity for teams to be able to change and move from that reactive way to proactive. So we're starting with building those teams. So the teams know each other, they know what each other do, and I'll bring this to life in a moment, some of the work that's gone on in Weymouth and Portland. And then start to streamline some of those systems and processes to release capacity for people to be able to take on this work, because we know that there's a lot of wasted time in terms of the way that systems work at the moment, or don't work, perhaps might be a thing. So then using population health data, starting to think about how we integrate care around those individuals with complex needs, so that's adults and children, and health and social care and voluntary sectors, just understanding actually who needs to be involved into best supporting that individual with those needs. Then what we plan to do then is to really identify, the next part is that who are those cohorts, those population cohorts who are at rising risk. So we can see those people who already got complex needs, but actually what are those population cohorts that we could engage with service users and communities to redesign that care and support offer with more care delivered in the community, more focus on proactive and prevention to stop them escalating. And we can identify those. We've got brilliant systems in Dorset through DICE to be able to work and look at those. And then working with those specialist services to really streamline pathways. And that doesn't mean that we're stopping doing any of that agreed primary and secondary care prevention work that needs to be done as well. So continuing the work around cardiovascular, around vaccinations, all of those screening programs. So this is on top of those things. So if we get this right, then what we expect to see is that at the end of the 2 years, the modelling says that we should expect to see 58,000 people adopting healthier lifestyle choices, 28,000 people who feel better able to manage their own health conditions in the community, 8,000 fewer prescriptions, and that's prescriptions for both medicine and for community equipment and things as well, but also a significant reduction in hospital attendances. So that's both unplanned attendances through emergency departments, but also attendances for outpatient appointments as well. 3,000 less people having to have an unnecessary stay in hospital. So that's stopping them even arriving at the ED first before future care takes on, or those people who, by actually doing significantly different interventions earlier on, changing lifestyles, won't need some elective surgery as well. And then hopefully then 12,000 fewer days spent in a hospital bed for admission. And some of that's about improving the pathways, but also some of that is by making sure that the population is healthier once it's going into hospital, so they're actually able to recover much quicker. So if I just let you know then just what's happening in Weymouth and Portland and Purbeck. So across Dorset there are 9 integrated neighbourhood teams. Weymouth and Portland is the one that we started earliest with, and I'm sure that you'll have heard presentations about the great work that Sarah and others led in the Portland area. And Purbeck is up and running. The other 7 are we just establishing. So just to give some examples about how we build these teams together, bringing these teams together is actually quite complicated. In Weymouth and Portland, there are over 50 different teams who work together. That's an awful lot of people who are dealing with the same cohort of people. And so they've been quite innovative around this. So in Weymouth and Portland, they're running lunch and learn sessions. So already they've got 35 services and organisations who've shared information. And they asked, before people went in, they said, can you tell me out of 5, they did some scoring, what you knew about this team, how confident you were about their services, and got an average score of 2.96. And at the end of it, the score was at 4.56. So significant increase in that, but probably more importantly, was that as a result of that, there was high percentages of people who said, actually, my service or team sees the same people, or my service meets similar needs. So the next step for those is to say, actually, if we're meeting similar needs, perhaps we should get together and have a conversation about how we improve that and improve that service for people. They're also using those sessions just to kind of have talks on good practice to make sure that these are multidisciplinary, multi-agency, BCSC, all sorts of people involved in this, as well as people from the community, to actually just share learning and experience with that. In Purbeck, they've taken a slightly different approach. So what they've done is their services have created posters that can be shared with team members. They're planning a series of short workshops around kind of just highlighting what services are available across Purbeck. And that's not just going to be useful for the teams working within it. They're planning to use that to share with communities as well, because we've got some of the best kept secret services available that people could access directly, but we don't always let people know how to do that. So then in terms of bringing the teams together to start making a difference with this, just a couple of examples here. So Weymouth and Portland have been doing quite a lot of work around frailty and falls. And they've established a joint triage meeting. And so at the moment, there are, if you need a frailty assessment, you can be referred to any number of teams. So community rehabilitation, primary care frailty, Dorset healthcare frailty, adult social care, virtual care teams, loads of different people. So what they looked at with that, by bringing those teams together and having that triage of the referrals, they've not been running very long, but already they identified that 35% of people have been referred to more than one service at the same or similar time. And of those, when they started looking, so a significant number of them didn't need to see multiple teams, and already have been allocating over a third of those to just an individual team being able to see them, which both improves the experience of the service user, but also reduces that duplication and starts to free up some more time for teams to be working in those different ways. They've got the lower limb multidisciplinary team meeting working on Portland. We've got practice nurses and district nurses coming together. And that's also starting to show the same thing, is actually a reduced need for onward referral. So actually those teams working together, sharing those expertise, they're no longer having to send so many people to the specialists, but also reducing that duplication. So they're not having both the district nursing seeing someone and the practice nursing seeing someone, actually being able to really improve that experience for patients. There's more to be done in that area, there always is. But what the INT, having heard the feedback from the previous one about saying, actually, our teams are doing similar things, they're starting a process within the health teams to start with, but they're looking then at widening that out to have some shadowing between teams so they can actually get a better understanding of what each other do and to identify what are those opportunities to really strengthen integrated working. While this starts on small scale, you can see how this could really snowball out and become all of those people working together to be able to do that. In Purbeck, they're using the population health data for their communities to look at where they should start bringing teams together. And where they're starting to think is that for them, what the data is telling and also what those community conversations have started identifying is that frailty, obesity and mental health are probably good areas to start looking at. So they are then bringing those teams together to look at how the current services work, how they can work more closely, and just removing some of those barriers to providing integrated care. I hope that was within my 15 minutes.
Brilliant. Thank you very much. Quick observation. Would it be correct to assume that as a result of this, there may be more people with greater numbers of potential vulnerabilities living within communities who are being looked after, but actually might need some support? I'm just thinking about, because we have colleagues from police here, but also fire service, postal workers, libraries, hairdressers. how do we engage the wider communities to make sure that we're aware of specific vulnerabilities or things just to look out for where people aren't aware that they're vulnerable?
That's a really good point. Do I think there'll be more? Potentially not. Do I think we'll be better at identifying them? Almost certainly, yes. As part of the work of identifying individuals who've got complex and those needs, I think that's where we can then, once we know who we're talking about and what the needs are, and also those population cohorts, I think that gives an ideal opportunity then to engage at that local level and think, actually, this isn't just about health, this isn't just about health and care, this is about health and care in the voluntary sector, this is about thinking about the police and the fire service. And we know that there's fantastic work already been happening around some of the prevention stuff in the fire service and some of those kind of more vulnerable families with the police. I think opportunity to build on those. I think key to that then becomes being able to identify who are and coming together in those multidisciplinary teams to actually agree a plan for those.
Communication and awareness raising across the area. We've got a question from Councillor. There are 5 councillors, I believe, online. Councillor Jones.
Hi, thank you very much. Carol Jones, Sturminster Newton and lead on the Vale Family Hub. The presentation seemed to focus very much on the professional and statutory services, and I was wondering that, for example, you mentioned in Weymouth you had 35 services and over 50 teams, and I'd really like to know what sort of percentage of those are actually within the voluntary sector, because in order for this to really work, it takes people on the ground. So and people on the ground, so not prescribing behind a desk, but actually on the ground and in people's front rooms and talking to people and so on. And I'm just sort of, I'm not quite sure exactly where the community comes in, how it comes in, and how that's actually brought into the mix in sharing information and boots on the ground, basically. Thank you.
Yeah, so I think it's a really good point. In terms of the Weymouth and Portland part, there's already quite a good connection in with the voluntary sector, and there's a lot already happening there. There is, in terms of the approach that we're taking with integrated neighbourhood teams, we're following a logic model, which starts by saying, we're taking a slightly different approach with this, which starts by saying, actually, if you can improve things for the staff on the ground, and if you activate staff so they feel motivated, empowered and able to do their job, what there is good research to show is that they then provide better services and are able to connect with the individual, you know, with communities and individuals and wider parts of it. So, and then by connecting with individuals and communities, what you then begin to get is much better health outcomes, which reduces the demand, which allows you to put back additional resources into prevention and proactive. So it's about a phasing thing. So where we're starting with this is about creating that capacity for the teams, which is why I've talked about a lot about the teams at the moment. As we identify those individuals part of it, this is where it has to be that kind of much wider approach to that, and also redesigning that with communities. This sits alongside that community conversation work that's already happening, so this doesn't sit in isolation. So what we're already asking teams to do, even before they're ready to go out and and engage with the communities, is to say, what do we already know in terms of what we've heard from communities? What can we see from the data? Who else is already working in those areas, and mapping out with it. Weymouth and Portland is a huge area, 76,000 registered population, and even just starting to map out all of the services and the community groups and the voluntary sector in that is a huge piece of work. But that's a really important piece of work to build the foundations for doing exactly what you're talking about happening. So it is definitely, we're not ignoring it, but we have taken health being a little bit of a pickle around fragmented services, which is why we've started with staff there.
Thank you. Can you just tell me, do you see an individual named lead on each integrated neighbourhood team? So there is one person pulling it all together?
So do you mean the professional lead, or do you mean?
Well, whoever's going to pull the whole team together, it has to be led by somebody. So will each team have its own named lead?
Yeah, so at the moment, so each team has got a leadership team in there at the moment, and that team is made up of somebody from primary care, somebody from Dorset Healthcare, mental health, and somebody from Dorset Healthcare, primary physical health, and we're also working with council to identify kind of the links in to that with the from the leads from the local authority as well. So that then becomes that local team who will become that hub who have those conversations and make those connections.
Okay, thank you.
Alice Deacon, Corporate Director, Commissioning and Partnerships. I think one of the things that I would say, and I know that I've said this to both Sarah and Judith around the fact that there's really good evidence already at play in the family hub space and the work that we've done together, and actually that's already contributing to the INT work, but we're not necessarily gathering some of those things, and that links to Councillor Jones's point here that actually there's already some things in there and already some mapping that's happening and already some work that I would say is reflective of the aspirations of the INTs, and that we probably need to get better at describing when we're doing that, how we're doing it, and what we're seeing from those patches of work. And that I was also sitting here looking at our plan, our work plan for this board, and thinking about how we've just talked really clearly about place-based partnerships and what we're doing across the piece, and how we might enable the reporting here to describe the golden thread. In June, I'll be bringing the Strategic Alliance annual report, which holds the lag space, which holds lots of place-based work. How do we then link all of the things we've talked about today together? So when we're bringing those reports, we're reporting on the work that I may have done through the Children and Young People's Plan and through that Strategic Alliance that will contribute to the INT work or to the place-based partnerships, and how it supports the infrastructure and the development of our partnerships across not just statutory partners, but our community groups. There's a wonderful video that's in its final edits about the family hubs, really describing all of that integrated neighbourhood work that is already existing, health visitors talking about seeing families, communities describing support being delivered where they want it in their place, and creating community and a network of support and needs being met. And actually it's connecting those threads together here through this board that I think will give real opportunity for us and the wider system partnership.
I just wanted to say a bit more about what's happening in Purbeck, because I attended the first engagement event in December, which I think was 120 people or thereabouts. It was lots of organisations from across Purbeck. I mean, I was wearing my chair of the Swanage Patient Participation Group hat that day, but I'm also on the Wellbeing Swanage Advisory Committee as well. So in terms of family hubs, those relationships are already getting very strong. So the Wellbeing Swanage and the Family Hub in Swanage is all under the umbrella of the Swanage and Purbeck Development Trust and the new Focus Centre. And there's a lot of joint working happening already there to strengthen those relationships. There's a series of community engagement events which we're working towards, probably in July. And I've been invited to be on that working group as well within the integrated neighbourhood team to actually help with that piece of work. And we're looking to have it at the Focus Centre in Swanage. And similarly, we decided that it needed to be a series of events in each of the areas of Purbeck. So that's something I'm excited to be involved with. And I've just been invited to be on the overall management team. I think that's what it's called as well. I shall find out soon. But so there's lots of work going on, particularly with the family hubs, the lag. And I think that when that really gets going in the summer, that's when we'll really be able to bring together all of the other organisations and that joint working. That's what I'm excited to be involved with anyway.
Julia?
Thank you. I'm Julia Ingram, Corporate Director for Adult Social Care. I don't think anyone can dispute the ambition or the principles in this piece of work. I think it's absolutely what we should be doing as partners across the system. I think we've heard quite a bit today about the complexity of the various programmes and work streams that are underway. And I think that Councillor Jones is absolutely right that the real success of a programme like this will be how communities engage and set the priorities for the communities, which we then as professional and statutory organisations need to wrap ourselves around. And if we're not careful, we'll get that the wrong way round, and we'll create a system structure that benefits us, but may not be as responsive and as applicable to those communities that we need to help, because the divergence in the responses, because the communities need a different response, is going to be what's really rich here. And I think from an adult social care perspective, we're very much looking at what are those programmes of work, what are our responsibilities in line with the council plan, of which Communities for All is absolutely key for that. And then how do we best, using the data we've got as a shared community, lean in when we understand what those communities are telling us they need for us, where we then best work together to be effective. Because I think if we don't get those bits right, we won't actually deliver the ambitions and outcomes that we need to do. So
final few comments.
So Paula Bennett's Dorset Assembly. I kind of wanted to highlight, Margaret was talking about the amazing work that was going on in Purbeck and the wonderful community engagement that's being planned. And I think it kind of highlights the point that Julia made, which is if we don't go out to the community early enough, they're going to end up hearing about parts of this and not necessarily be ready to embrace all or to be actively involved to co-design. It's really hard to keep them out. So they're going to wheedle their way in one way or another. And if you go through the integrated neighbourhood teams programme, somewhere down towards the bottom, there's community activation. There's talk of a community activation tool to be used. And actually, I think that needs to be raised up the profile a little bit sooner, because community activation is not the same as community involvement. So getting the community primed and ready, the community knowing what's coming, what's being asked, the way in which locality, place-based working is becoming more and more of a priority. Actually activating the community is stage one, really. And I just feel that we're kind of at that place where we could be doing that. There isn't really such a thing as a community activation tool. There are versions of tools, but there isn't kind of a primary one. But I think there's probably a great stage of involving infrastructure organisations in Dorset to develop a Dorset activation tool. I think there's a really good opportunity there.
Final comments, Sarah?
Yeah, thanks. And hopefully just to kind of summarise the conversation, I think, I think for me, in many respects, this really isn't anything terribly new, but I think it's about how we work together and bring things together from a community kind of bottom-up type approach, really. And it is about our teams of individuals across all services working better together. So I think we have to kind of just start we have to do it in stages. I think that's kind of the message we're hearing, and the update, particularly from Judith, because this could be huge, and it should be huge. But it's about us kind of, as I mentioned earlier, really kind of holding that and pulling all of the parts together. Steve, you asked an interesting question a week or so ago around timings, because some of the work, particularly around thriving communities, for example, being led by Dorset Council, is kind of progressing at a particular pace, which is brilliant. The INT work, as we've just heard, perhaps feels kind of slower in many respects, because it is really very complex, and it is about getting to know each other and all that kind of thing. But I think the important thing is that it will all come together eventually. That's my positive mindset anyway.
We're in a positive view today. Yeah.
So I'll leave it there.
Cool. Thank you very much. Thank you so much. Again, it's all parts. The threads are there, and we need to knit them together into a really good fabric. He said, extending the metaphor possibly too far. Thank you. Joint strategic needs assessment update, Natasha.
Me and putting some time on the agenda. I really appreciate it. For us, I'm the team leader of the intelligence team. What I wanted to do today was just talk to the paper that was in your agenda pack to update on the progress of JSNA work around children and young people, which was highlighted as a priority by the board. So I really wanted to share where that had got. So we've been doing some scoping work over the last year with a variety of partners and people working in the space to understand what some of the key questions that they want to know in the JSNA, and also pulling together from a range of data sources, from local data, data that's published nationally, data from our partner organisation, DICE system, and we've got a wealth of information. And the aim is to produce a high-level overview of health and wellbeing challenges. So looking at what are the current trends and issues, and also what we might want to consider in the future. Attached as an appendix is a copy of the needs assessment. For time, I'm not planning to go through all of that, but I'm happy to take any comments or questions, because I'm aware it's a very broad topic, which has created a quite lengthy document, but hopefully is digestible. The assessment itself is structured around the 3 integrated care partnership strategy themes. So we've got a section called Thriving Communities, which is looking at those kind of wider determinants of health, things like the environment that people live in, the education that is available to them. We've then got Healthy Lives, which is starting to dive into the more specific conditions or healthy behaviours that might affect children and young people and their families. And then we've also got a section on health and care, which is more looking at that service-specific data view and a picture of the services that children and young people might be accessing. If I was to summarise the key messages from that whole report, I think I'd say generally in Dorset, health compares favourably to many other places, and we have a lot of positive assets. I think that's really important to bring across in an assessment like this, because quite easily with joint strategic needs assessments where you're focusing on looking at trends, we can look at what's worsening, but I think it's important to acknowledge what's good about growing up in it and the positive assets that we have locally. Things like our unique environment, good education opportunities. We've seen improvements in breastfeeding rate and smoking rates in mothers, and we've seen some improvements to social care referral. I think the challenge for us to consider locally is variation. So the fact that whilst generally health is good, not all children and young people have that same experience or same health outcomes. And I've tried to highlight that throughout the assessment, looking at areas where there might be variation, whether that's a geographical variation or looking at particular groups who might be at more risk of a poorer health. It's also, I think, important to keep an awareness of emerging issues, what's new, what's growing, and an eye to the future. So such as school attendance, not just a local issue that's been seen nationally, that school absence has been increasing, hasn't fallen post-pandemic. New to the report this time is a horizon scanning section. So that's where I was really keen to help bring some conversation points and consideration points for the future. So looking at things like the smoke-free generation ambitions and how that is important for our children and young people. Looking at the opportunities and growth in digital. There's a lot of opportunity there in terms of personalising care and making things accessible online. But I think we also need to consider the negative downsides of a more digital society and understand the kind of stresses and experiences that children and young people might face growing up in a more highly social media driven environment. And thinking about mental health as well is a really important area. Throughout the report, I've also tried to emphasise the views of children and young people, so pulling from the range of fantastic engagement and listening work that's going on across the system, from 100 conversations and community conversations to local consultations and youth projects. So trying to raise the awareness of all of these projects that are going on in the JSNA as well. One area that did come out of conversation with various stakeholders is some of the knowledge gaps that we might potentially have, or things we'd be interested in finding out more about in the future. So an example of that, talking about the smoke-free generation ambition, is it would be potentially really useful to have a better understanding of smoking and vaping behaviours locally. Whilst vaping is a really useful tool for adults who smoke, it's something that we don't want children and young people to be vaping. So I think that's a really interesting insight area to find out more about. And oral health, so dental health. There is a survey that has been recently conducted and waiting for the data to come out, but that again is another area where we'd like to kind of have some more robust information. That's a brief summary of the structure of the paper and how it's come about. I'll very briefly touch on the JSNA process. So we've had an established process with Public Health Dorset leading. Obviously, with the disaggregation on the 1st of April, we'll be having some system discussions about how that process moves forward and is discharged for the Health and Wellbeing Board. So just briefly wanted to touch that those conversations will be coming, and we'll be planning the forward work plan for the JSNA. But just in conclusion, wanted to draw your attention to the work that's been done and provide the paper for your information and your perusal. And thank you very much for your time today. Welcome any questions or comments. And please feed back to me at any time, anything to do with the JSNA.
Thank you very much. I must confess, of all the things that are on the agenda today, I'm probably least aware of this because it's outside my normal sphere. So how will what you're doing through this and your research and your question, how will that fit into things like the other things we've talked about today, integrated neighbourhood teams? Because we need to be a sort of a one system approach. And it strikes me there were so many potential points of contact, and how can we maximise that, and how could we make that work?
Definitely, and the purpose of the JSNA is to provide an evidence base, essentially, for the Health and Wellbeing Board, but also all of our partners, because we do have cross programmes, cross contacts. I like to ensure that the JSNA is a shared process and work with all of our partners to develop the needs assessment and the forward plan. And I'm certainly having conversations with different partners and involved in the data groups linked to the INT's work, for example, to help raise what do we know in the JSNA and how can that feed into these programmes of work. So in terms of the insight side of things, I link with intelligence partners locally working on all of these projects and raise awareness of the JSNA. Rachel, just want to come on.
And just to add in, the Joint Strategic Needs Assessment is absolutely part of the role for a Health and Wellbeing Board. So the Health and Wellbeing Boards have to conduct Joint Strategic Needs Assessment, which then informs the development of the strategy, which we have taken to be part of the development of our integrated care partnership strategy. So they were all aligned, and we didn't get drawn as a system to having multiple strategies or multiple priorities on a whole load of topics. I mean, we've got enough anyway. But in terms of the timing of why we've got a topic on children and young people. It's not because Ofsted are in the building. That's just happy circumstance, colleagues.
I'm just looking through our children's JSNA and see it beautifully reflects, that was published in January, and see it beautifully reflects where we are as children's services now, talks about our integrated locality model and all of the things that it should, as well as children's needs and how we're responding to them, which is what we want to see as a
The final link in the chain. Wonderful. Thank you very much indeed. Thank you. Okay. Thank you very much indeed. Our final item on the agenda today is right care, right person. Julia.
Thank you. So Julia Ingram, Corporate Director, Adult Social Care. This is actually a joint piece with my colleague, Sunita Katra-Hall, who's tied up in Ofsted, so unable to deliver. And this is really to give the board assurance. I'm hopeful that most of you will be aware of Right Care, Right Person, which is a national initiative to make sure that when people are in mental health crisis, the right people are intervening at the point of need, because it is recognised that historically the balance has drifted in the direction of the police picking up an unfair distribution of that work, which has distracted them from doing some of their more key statutory functions. Just to reassure people, Right Care, Right Person, which was operationally live from April 2024 in Dorset, does not distract from the police's responsibility to intervene if there is evidence of immediate risk of harm to individuals or the public. Those responsibilities still stand. But what it has allowed is key statutory partners to come together to look at actually where people do have statutory responsibilities and how in 4 key areas we need to align ourselves to make sure that the right people are stepping in at the right place. And those 4 key areas are around when someone has a welfare concern, when someone is absent or walks out of a hospital environment, if someone needs the protection of a 136 suite, and then transportation for a mental health Act assessment. So the policy in Dorset, as I say, has been live since April. It really has been a partnership piece of work. It's delivered through a steering group, and there have been open and honest conversations about the opportunities and the challenge, but there has been consensus across that partnership about the need to get this right. Most of the work is progressing well. There are outstanding areas where there is still development, although the 4L areas have gone live. We're learning in the moment and learning from practice. So there's still further work to be done about the 136 policy and clarification on the transportation work, which started in or went live in January. And to show you or give you assurance that there really is recognition that we have to work together. It's been identified, certainly in the arena of adult social care, that sometimes the escalation policy that's been put together through a memorandum of understanding has not been as effective as would have been required. It was slightly process heavy, which meant that when an urgent response was needed, we weren't always able to have conversations in the right place. But that's been recognised by the programme group, and we're undertaking work at the moment to revise that, and we're looking at national best practice to inform that, to strip out some of the processes so that if we need to escalate an issue, the right people are having the right conversations in the right time. So as I say, it's really to give the health and wellbeing board assurance that that work continues. It's got the right levels of governance within the local authorities, so the Safeguarding Adult Board, the Children's Safeguarding Boards, the Children's Strategic Alliance, the Integrated Care Board, and the Police and Crime Board all have oversight of this piece of work, and we're increasingly getting evidence collected by all the partners about where we're intervening and looking at lessons where it hasn't worked well. Don't know if there's anything else that I can say.
Foundational. Any questions, thoughts, comments? Okay, it's one of those foundational pieces of work that stitches everything together, going back to my tapestry, but that holds things together. So please pass on our appreciation to everybody. There's sometimes some quite difficult
And there,
discussions.
and there are lessons. We haven't always got it right. But I think what is evident is the willingness for people to pause and learn from that. And I think that's really important partnership working.
Thank you. So the final item on the agenda is to note the work programme going forwards, which is included in the pack, which is so done. I don't believe there's any exempt business. And I'm also pleased to report that my watch is running slow, so therefore I can declare that as far as I'm concerned, we've finished on time, or at least my watch is concerned. Thank you everybody for coming. We've had 6 items on the agenda today, all of which are stitched together, I think, beautifully. And I think they're evidence that we are working together with the same vision and the same principles. And so I'm looking forward to this continuing in future meetings. Nice to meet some of you for the first time, others ongoing. Have a good rest of the day. Thank you very much.